Return to our earlier story of the coronavirus, where the Delta variant is ravaging the country now, and then the testing has reduced, very, very largely. I was speaking with the MD CEO of Clina, Lancet Laboratories, Dr. Olayemi Dawodu, who is joining me on the news at 1 to talk about this. Thank you so much for joining us. How worrying are you when you heard that we have more than 200,000 cases? They dropped from 735,000 to 521,000. That's about 200,000. That's again 29.08%. How worrying is this?
Hi, good afternoon, and thank you for having me. Well, it's actually worrisome because it shows that we're obviously under reporting, and that is not very good, especially now that we have an upsurge in infections. So in order for us to plan properly, we need to ensure that all the platforms are testing at capacity and optimally. So it is concerning because it means you were not able to plan adequately for whatever disease burden is with COVID currently.
So we have currently confirmed cases, which has risen to 170,306. This is implying, or this may imply, that the cases recorded may be far from reality. What exactly do you consider responsible for these, latest discovery?
So I think it's an apathy as well. It's just the same way you see people not wearing their masks, and there's just a lot of complacency. Yes, fortunately, at least a couple of months ago, we did go down in terms of our positivity rate. And I think it's also evident in even closing down of isolation centers. Unfortunately, this has also entered into the testing space because at those periods, we didn't have the numbers that we're now currently seeing upsurging. But I think that in terms of being anticipatory and preemptive, we probably shouldn't have let down our guards in terms of whether it's closing down this testing sites or the other supports that we need for COVID, especially because over the last few months, we've all been aware that, it's imminent that we would all experience the third wave, and then with the emergence of the Delta variant, it's something that I believe we shouldn't have let down our guards on.
Well,
I think that's what has been responsible for that.
Right.
It's just the general apathy.
Right. I'm in the news business, and of course, you're also in the health business. So you understand the variant, the new strain of the Delta variant. We see what this has done in India, for instance, and some other countries. But if you talk to Nigerians, they believe that there is nothing called COVID-19 in the first place. So they believe all of these things is a hoax. So are you saying, or would you say that we've not really done so much in sensitizing people, or because Nigerians just don't want to believe their government whenever they say anything?
Yeah, I guess it's multifaceted. I believe we as the medical community still have a large role to play in terms of being in people's faces concerning health education and advocacy. I must admit that a lot of citizens are skeptics, and it's also evident even in the take-up of the vaccination. We do know that there's an advent of the Delta variant, but we also know that, even though people are still working around how protective it is, I would still advocate that it's still important for you, if you have availability, to get the vaccination to ensure you do so, because this is supposed to kind of mitigate and ensure that the kind of infection, even if you do get infected, you have, is not serious enough to land you and need you to be hospitalized or on oxygen as well.
Well, we're trying to see how the ability Nigeria has in order to sustain, different kind of cause whenever they, get on it. MD CEO of Clina, Lancet Laboratories, Dr. Olayemi Dawodu, thank you so much for speaking with us on TVC News.
Thank you very much for having me.